So with anatomy and physiology, anatomy is the study of the form, just the names of what's there. It can be as simple as straight memorization of the structure names, which is mostly what we do in lab. And physiology is the study of how those structures work together to perform functions. And that will mostly be discussed in lecture. With microscopic anatomy, you'll see in the next few slides up with a hierarchy of organization. Cytology and histology are right next to each other. Histology is study of tissues. You think like pathologists, things, people that are looking for disease, looking at tumors, things like that. They're histologists or pathologists. And cytology is the study of individual cells, kind of a little bit smaller level. But these are both microscopic anatomical fields. And if you look at gross anatomy, which you think dissection, things you can see with the naked eye, you have systemic anatomy. It's a study of each system, which is usually how textbook chapters are laid out. If you look at your textbook, it's most of the chapters are by system. Regional anatomy looks at different regions of the body. Surface anatomy. You think of the doctor as they're palpating and feeling around. You can feel the liver from the surface, but you have to know where to look for the liver. And comparative anatomy and embryology, think more of biological sciences, like comparing humans to other mammals, or dissecting human versus fish versus cat, things like that. And embryology is a study of those chordates and things like that as they change from a union of a zygote to an embryo and fetus. So physiology, I think, kind of goes along the lines of medicine. Medicine is very much a study of physiology, and usually they're studied by systems. In most cases, cardiovascular physiology obviously looks at the cardiovascular system. Neurophys looks at the nervous system. Likewise, respiratory, reproductive, pathophysiology. Again, if you know your prefixes, pathos, is the study of disease or injury to a system, the study of abnormality. So to kind of understand things as complex as a human, it helps to think of different kind of levels of organization. And we'll start at the smallest level of organization, and usually the most simplest, and work our way up to the largest and most complex. So you start with the smallest. Again, the chemical level. It's critical to have an understanding of chemistry. Most in anatomy textbooks, the first they have chemistry within the first couple of chapters, and you need to know ions, positive versus negative ions, how they interact, how chemicals bond, and covalent versus ionic, and you need to have a foundational level of chemistry in order to understand everything that goes on above, especially with regards to physiology. And put various chemicals together in a way, and you get this emergent property of life at the cellular level. So with each step from one hierarchical level to another, there's what they have referred to as emergent properties. And as you go from the chemical level to the cellular level, you can see life occur, because the cell is the smallest unit of life. And again, you've got these various various cells that come together to form tissues. You can think of tissues as like muscle tissue, or your skin is a tissue, things like that. So they're you've got this more complex thing that a tissue can do that an individual cells cannot do. Organs are made of various different types of tissues. We'll study 4 basic types of tissues and their subsets, and basically everything out there is made of those 4 types of tissues. Organs, again, it can be something as simple as your lung or heart, or a muscle. People don't think of it, but a muscle is an organ or bone. And we look at organs as how they function as collectively. So we usually study them on an organ system level. Again, look at all your chapters in your textbook. They're all organized by organ systems. We have your cardiovascular system, your respiratory system, reproductive system, etc. All these groups of different organs, all coming together for working to do some common collective goal. And again, some organs can be in multiple systems. An easy one is the pancreas, or even the ovaries and testes. They're part of both the endocrine and reproductive. The pancreas is part of the endocrine and the digestive. And again, you throw all these kind of systems together collectively. What is it we're studying? We're studying the next hierarchical level up, which is the organism. And then again, the emergent property there is consciousness. When you go from system level to organism level, so that's an easy emergent property to see there as well. So again, kind of photographs showing each emergent or each hierarchical level as you go from the smallest and simplest to the largest and more complex. And again, it kind of helps to think of like what system or what level you're thinking at or looking at when you're looking at different diagrams in the textbook, or we're talking about cells and tissues, things like that. So everything we talk about, the body that we talk about and we study is understood to be in anatomic position. All right, that is an agreed upon position that our body is, where we're standing upright, our feet are flat on the floor, our arms are at our side, and the thumbs point out. It is very important that the thumbs are out. That keeps the radius and ulna from being crossed. So that means that the palms are, again, placed anteriorly towards the front. So what we're always talking about a body in that position, and we talk about the right or left. We talk about that body as right or left. Other various positions, you can have supine and prone. These are two basic positions. When you guys get into nursing, you'll talk about other positions to have your patient in, but supine is face up and prone is face down. Those are some very, very basic ones you should know. So we're no longer going to say up and down. We can use left and right, but that's about all that you're familiar with that we're going to use. We're going to use superior and inferior for above or below. More specifically, cephalic means towards the head. Caudal means towards the tail, or where our tail used to be, which is our coccyx. Those are used, superior and inferior, cephalic, caudal, those are used mostly for the head and trunk. As is anterior, in front of, or posterior, behind, and ventral, specifically belly side, and dorsal back. Think of the dorsal fin of a fish. Those are specific to belly and back, as are cephalic and caudal specific to head and tail. Now again, those are all used in the head and trunk. When we talk about the arm and leg, we have proximal and distal. Proximal is closer to the point of attachment, and distal is farther from the point of attachment. When we talk about when we use these, when we use all these terms, these are comparative terms. We cannot say something is distal. We need to say something is distal to something else. So we're comparing two things. You always got to keep that in mind when using these terms. Lateral and medial. Medial means toward the midline, which is an imaginary line that splits you down into equal left and right sides. So medial is towards that midline. If something sits on that midline, it is median. You just replace that L with an N. A median structure is a structure on the midline. Lateral means away from the midline. Just like Shrek and onions, we have layers. So superficial is the first layer that you see, and as you peel those layers away and go deeper and deeper within that onion, or dissect your structure and peel layers away, you start off with a superficial layer. The next layer down is a deep layer. That layer there is going to be superficial to a layer that is deep below it. So again, these are all comparative terms. There is probably no really deepest layer, but this most superficial layer would be, of course, your skin, what we see as each other. Another important one you don't see in a lot of textbooks, I think you should know, is ipsilateral and contralateral. These terms you can see sometimes in radiology reports and things like that. Ipsilateral refers to the same side as whatever it's referring to. Again, these are comparative terms, and contralateral is the opposite side. You should definitely know all these and start to use them when you're describing things in the body. Again, just kind of a diagrammatic. We are bipedal, so we stand upright. So again, superior is cephalic to us. Inferior is also caudal. And posterior dorsal, anterior ventral. We walk into a room belly first. Again, proximal and distal are saved for the appendages, the arms and the legs. So again, you look at us versus cats. If you talk to somebody that is going to be studying quadrupeds, what is dorsal is superior, because a cat walks into a room head first. All right, their cranium is anterior; it's in the front. Their caudad or caudal, their tail is posterior. So when you look at the cat on the left there in quadruped position, he walks into a room head first. In biped position, he walks into a room belly first. So the anterior portion of that cat is ventral. Okay, so just something to keep in mind. All right, cranium and tail are specific to the cranium and tail, regardless if the cranium is pointing forwards or if the cranium is pointing up. Again, just kind of some diagrams out of a textbook. You should be familiar with all these. Again, proximal and distal. You could say the knee is proximal to the ankle. You can also say like the wrist is distal to the elbow. So those are good ways of using those terms. Again, medial towards the imaginary midline. It splits you into left and right halves. Lateral is something away from that midline. So you can say the eyes are medial to the ears. The ears, again, will be lateral to the eyes. Again, superficial and deep. Again, I like the analogy of Shrek and the onions. You know, you've got multiple layers. So, a deep layer can be superficial to another layer that's, deeper than that. So just keep in mind their comparative terms. Again, anterior is ventral to us. You can use either or. Sometimes I use them interchangeably, but you'll run into places that are more specific. You talk to radiologists, they like to shoot an AP, which is anterior to posterior. They don't say ventral or dorsal. So when we look at an organ, you've kind of looked at planes already in these last few photos. A plane is a section or a cut through something. Okay, if we're looking at tubes, we are basically a tube. So you have two axes, a longitudinal axis or a long axis of that tube. You can go parallel to that, as you see in that longitudinal section, or you can do a transverse or cross section, which is 90 degrees to the long axis. An oblique is any angle besides any angle between 90 degrees and 180, or whatever, 0 and 90. Oblique sections are not usually something that you aim for, but they do happen. Now, when we move on and think about other things, what you see depends on how you section something. So when you see something as complex as a tube, or like this, what you see could be really varied depending on where you're actually taking that slice from. So just something to kind of think about when you're looking at microscopic slides of tissues and things like that. So again, slices of actual piece of material is called a section. Sections are ideally cut along planes, which is kind of an imaginary thing. But planes, we'll talk about three main types. A coronal, or a frontal plane, divides you into anterior and posterior halves. Okay, so a coronal plane divides you into front and back. Transverse, or cross-sectional plane, divides you into superior and inferior halves. Okay, so a coronal is one of the two longitudinal planes. Now, because we have a front and a back, it looks different. We can have more than just one longitudinal plane. Okay, so we have the coronal is one of the two longitudinals. Transverse or cross-sectional plane, obviously, is that transverse section. The sagittal plane is our other longitudinal plane that we can have. Now, sagittal plane divides you into left and right halves. One specific plane divides you into equal left and right halves, and that would be the mid-sagittal plane. Okay, so a sagittal plane can divide you into unequal left and right halves. Just one section, one plane out of those multitude that you can have is the mid-sagittal. divide you equal left and right halves. Sometimes you want to see things that are right on the midline. Sometimes you want to see things that are not quite on the midline. So you use mid-sagittal versus sagittal. Again, a median structure lies right on the midline, so you can call mid-sagittal the median plane. But mid-sagittal is typically used as well. And again, the oblique plane, any section or plane between 0 and 90 degrees. And again, it's not usually desired when you look at histology and things like that. So your three planes. So you see the coronal plane, and that coronal plane section through the head, where you can see the brain and the two eyes. The coronal plane is very useful in certain aspects. Sometimes you'll get like a CT scan, and you'll get a series of coronal planes as you go from travel from anterior to posterior, or vice versa. But the coronal plane separates you into front and back. The transverse plane. If we were a loaf of bread standing on end, the transverse planes would kind of like be our slices. And again, what you see there is very useful in different ways, as is what you see in sagittal sections. It's just depends on what you want to look for and how you put that together. Obviously all three. If you could compile all three images, you could have a three-dimensional type of an image. So again, you should know those planes and start thinking about, when you're looking at diagrams in the textbook, what plane is this that I'm looking at? Just something that would help. So again, here's a sagittal plane, separates you to left and right, but it's not necessarily on the midline. The one on the midline is the mid-sagittal plane, and a transverse plane separates you into upper and lower halves, inferior and superior. Frontal separates you into anterior and posterior halves, and an oblique is kind of like a transverse that's just not straight, basically. Okay, so regional terms of the body. You should know the various surface regions of the body. I've included some from a couple of different textbooks. Use these plus what is in your lab manual. You might see a little bit of lacking in one or the other, or some overlap. But I like this because it's got the different areas kind of shaded. You can see the sternal area kind of shaded green, as well as the vertebral area, things like that. So you should know kind of surface area. And again, they're often named for what's deep to them. But be familiar with these areas. As you see, anterior and posterior wise, you should be kind of familiar with the surface anatomy. And again, this set here, this colorized set, is a little more Latinized than what you see in some of the others. As you notice, it said manus for hand and pes for foot. Manual labor is labor used with your hand, and pedal, podiatrist is, refers to feet. These are a little more Latinized than you see in some. Again, out of a kind of a textbook, this has just got actual photograph, and it's kind of labeled. You've got a point at the end of the line. And sometimes it's more than just that. It's a region. So it's something else to kind of think about with surface anatomy. It's not just a specific spot. Sometimes it's kind of a larger area that, again, sometimes they'll overlap as well. Again, you should be familiar with these different regions on the surface of the body. We'll talk about them later. Okay, so the body cavities. Some textbooks leave some out and only talk about the ventral cavities, but you've got two basic groups. You have dorsal cavities and ventral cavities. And again, the names of these sometimes will change. I've seen different names for the dorsal cavities, but we'll just call them dorsal and ventral cavities. The dorsal cavity is completely encased by bone. That is basically your cranial cavity up top and your vertebral cavity / canal formed by the collective vertebrae down below. This encloses your brain and spinal cord. So it encloses and protects these delicate structures, but the drawback is if those structures are injured and they start to swell from inflammation, they're trapped in their cranium and vertebrae, which is why you have to sometimes have surgery to alleviate that. So there's definitely pros and cons, but dorsal cavity is your cranial and vertebral cavity. The ventral cavity, again, fair amount larger. Dorsal cavity obviously is anterior placed. Kind of think of our thorax and abdomen is the ventral cavity. A little bit of protection from bone, like the ribs around your heart and lung and around your thorax, but not quite the protection you have in the dorsal cavities. The ventral cavities need to flex and move. We are breathing with our ribs, so they need to be a little more flexible. And they cannot be as rigid as our cranium is. So superiorly, we have the thoracic cavity separated by the abdominopelvic cavity by the diaphragm. The diaphragm is that structure that separates those two. So again, looking at the body cavities, the ventral cavities are much different than the dorsal cavities. They're lined with serous membranes. So this serous membrane, it is a continuous membrane, but the membrane basically turns and does a 180 turn at some point, and goes from covering the organ in that cavity to then lining the wall that organ sits in. So it's a continuous membrane, but we talk about two different parts of it, the parietal and visceral layers. So the parietal, think partition, lines the wall. Okay, that's lining the room that the heart or whatever organ we're talking about is sitting in. So the parietal layer lines the outside of the cavity. The visceral layer covers the organ. If you think the organ is a viscera, to eviscerate is to gut somebody. So the viscera is lining the organ itself. So you think of those two kind of terms and what they mean. So we'll talk about three different serous membranes, but these all have cavity, again, between the visceral and parietal layers with a little bit of serous fluid, very mucus-like, very slippery, and it allows those organs to move past one another as we move around and breathe, our heart beats, and things like that. So the serous fluid reduces friction as our organs move past one another. So we look at the cavities again. The what's labeled here is the posterior aspect is what we're going to call our dorsal cavities, cranial cavity and vertebral cavity or / canal. The ventral cavity again subdivided into thoracic and abdominopelvic, those two separated from each other by the thoracic diaphragm. And again, you look at the thoracic cavity, it's separated out into a left and right pleural cavity, and there is the mediastinum, and below it the pericardial cavity where the heart sits. So we look at the various cavities. That's kind of where they are all oriented with each other. Okay, so the cavity and the membrane, the visceral and parietal membrane, they are often kind of represented by putting a fist into a partially inflated balloon. So you've got the part of the balloon that is against the hand. That would be the visceral layer, and the parietal layer is the free portion of the balloon, which would be lining the cavity that this organ is sitting in. So with regards to the membrane of the heart, again, we have the mediastinum, the space between the two pleural cavities, and the pericardium is that serous membrane layer. So we have a parietal pericardium, which forms a sac around the heart, kind of lines that mediastinal space where the heart sits, and the visceral pericardium, which is the actual outer layer of the heart. As we study the heart itself, we'll see that visceral pericardium is actually the outer layer of the heart when you study the three layers of the heart. And again, the pericardial cavity between the two containing serous fluid, so that when the heart beats and twists, it lubricates and allows that heart to do what it needs to do with very little friction. So when we look at the lungs, the serous membrane there is referred to as pleura. So we have pericardium around the heart, we have pleura around the lungs. So we also have parietal and visceral pleura. So again, with each of these membranes, we have a visceral layer and a parietal layer. Parietal pleura lines the rib cage, and if you've ever prepared barbecued ribs and taken off that silver skin and on the inside of your ribs, on the inside curve of the ribs, that is parietal pleura. Visceral pleura covers the surface of the lungs, and again, the pleural cavity between the two has a little bit of serous fluid that allows for lubrication. And when you take a deep breath and your rib cage expands and your lungs slide past and expand as well, they do just that. They slide past it because that's serous fluid. Pleurisy is an inflammation of that pleural membrane and a kind of drying of that fluid. And if you've ever had pleurisy, when you try to take a deep breath, it's very sharp stabbing pains in your rib cage as your lungs don't slide past the ribs like they should. So again, diagram showing the pericardium and the pleura. The parietal pericardium is the outer layer. The visceral pericardium is the inner layer right next to the heart. Between the two, a little bit of the serous fluid. Likewise, you have a parietal pleura lining the rib cage and a visceral pleura covering the surface of the lungs. Between the two, you have that pleural cavity with a little bit of serous fluid. Now, within the abdominal pelvic cavity, we can talk about separations. And again, the abdominal cavity versus the pelvic cavity is really separated along an imaginary line between two points within the pelvis. But the abdominal cavity is more superior. Most of the digestive organs, kidneys, most of the ureters, the organs that lead from the kidneys down to the bladder. And when we look in the pelvic cavity, we have like the bladder, the distal part of the large intestine, the rectum, reproductive organs, and things of that nature. So pelvic cavity versus abdominal cavity is not really a hard and fast line. It's really more imaginary kind of drawn line between 2 points. Now, when we look at the membrane that lines that, we have what's referred to as the peritoneum. All right, if you've ever heard of peritonitis, it's an infection of the peritoneum, which can happen if somebody gets stuck in the abdomen or something like that, and the large intestine perforates or something like that, and you get fecal material within the peritoneum. The drawback of the peritoneum is it is a basically superhighway that can connect all the abdominal contents together, and if you get an infection on that peritoneum, that it actually does allow this infection to spread rather quickly. So we have, again, kind of 2 portions, the parietal and visceral peritoneum. Parietal peritoneum is, again, at the outer wall of the abdomen of the abdominal pelvic cavity. Visceral peritoneum covers the external surface of the organs. Now, there's a lot going on in the abdomen, much more than just a single heart or a pair of lungs. So what we have is referred to as mesentery. There is areas where the parietal peritoneum comes off of the wall and forms 2 layers that is at that point called the mesentery, and it goes out to a certain distance, and then those layers are split and they will become visceral peritoneum as they surround an organ. Mesentery has got blood vessels that travel between it, nerves, things like that, so, and lymphatic vessels as well. So there's mesentery is a very interesting looking thing, and we'll talk about the difference between mesentery and omentum, but just be familiar with that. And again, the peritoneal cavity is all that fluid-filled cavity, much kind of a larger space than you would have with the pleural or pericardial cavity. But the peritoneal cavity is basically the space, the fluid-filled space between the visceral peritoneum and the parietal peritoneum. So we've got those 3, peritoneum, pleura, and pericardium, each with a visceral and parietal layer. So know those, please. Again, kind of a diagram of what mesentery is versus visceral and parietal peritoneum. You see the parietal peritoneum is blue in this diagram. The visceral peritoneum is red, surrounding the organs, the stomach and the liver there. And the mesentery, where the parietal peritoneum comes off the back wall and forms a dual-layered membrane, is shown in purple. And again, mesentery is a way of connecting this really long tube. We think of our small intestines, connecting all the length of that tube with one kind of common area. And again, what you see traveling through mesentery, arteries, veins, and nerves, should give you an indication of their function as well. So when we look at the 9 abdominal pelvic regions versus the quadrants, the regions are usually more used by anatomists. The quadrants are usually more used in medicine. But you should know the 9 regions: the epigastric, umbilical, and hypogastric along the midline, and the hypochondriac, lumbar, and iliac along the left and right flanks on either of those. So you should know your 9 regions, and again have an idea of kind of what organs are in each region, or where you can find the various organs. So again, just know your regions and what organs you would expect to find in each region. Again, the quadrants, again, they're centered on the umbilicus. Likewise, you should know your quadrants much easier again than the regions. And again, I believe these are more medically used. And you have your, again, left and right, right and left upper and right and left lower. And again, they're kind of centered on the umbilicus. You should know what organs you would find most of in your in which quadrant. So, looking at the organ systems, again, you can kind of scan your table of contents in your lecture textbook and kind of see all these as well. But we'll look at the 11 systems of the body. With each organ system, you should be able to tell me like what organs, example of an organ or two that are a part of that system, as well as kind of like a function of that system as well. And another thing to kind of just start thinking of is how all these systems are interrelated to each other. So again, kind of like a general overview of abdominal and thoracic organs. You can see these in the models in the classroom, but you should start to be able to identify the organs kind of on site as they would see them, something like this. So the integumentary system is our skin. That is probably what you're most familiar with as you look at it every day. Prevents water loss. Basically, it separates us from everything else that is not us. Produces vitamin D. So this is our integumentary system is our skin, hair, nail, sweat glands, the accessory organs that are kind of embedded within our skin. Skeletal system gives us shape. This is our bones, cartilage, ligaments, joints. The other thing not really obvious is it produces blood cells. The red bone marrow within our skeleton is very important in hematopoiesis as well, and storing fat. Muscular system. Again, without the skeletal system, the muscular system would be kind of useless, but the muscular system moves us around. All right, the muscles pull on the bones. As they do, they generate body heat as well. So you think of the first thing we do when we're cold is we shiver, we contract our muscles. So the muscular system and skeletal system are very, very interrelated. And again, you should start kind of thinking about that interrelatedness with all of them. Nervous system, control, very quick control. This is our brain, spinal cord, all the nerves within our body, both spinal and cranial. Basically, we respond to things within respond to things in our environment around us, and we do something in response to that. Also, higher kind of function, intellect, our intelligence is within the nervous system as well. The endocrine system, like the nervous, is kind of regulatory, but this is over like a slower, longer scale type of thing. I think metabolism, growth, reproduction, the drive to reproduce, and it involves many glands. These are our endocrine glands, our pituitary, pineal, thyroid, thymus, adrenal glands, our ovaries and testes, and parts of the pancreas, the islet cell, is endocrine as well. This regulates our blood glucose level. And again, here's an example of an organ that is in 2 different systems. The pancreas we'll see again in the digestive as well as the testes and ovaries. Those are in the reproductive systems. So the cardiovascular system basically transport. We transport nutrients, waste, gases, hormones, you name it. the blood is transporting it around from one area of the body to either other specific areas that pick it up or everywhere. And it consists of the heart, the blood vessels, and the blood within. The other thing that is moving is heat as well, that the muscular system is generating, so it's kind of acts as our radiator. So there's a lot being transported by blood. Lymphatic system is very important and sometimes often overlooked. The cardiovascular system basically is leaky. All right, so the capillaries within our cardiovascular system leak water into our tissues. Part of the lymphatic system's job is to take that fluid, that water, back out of the tissues and return it back to the blood. So it's very important in maintaining fluid balance. And as it's returning that fluid back to the blood, it passes that fluid through lymph nodes where our lymphocytes, our B cells and T cells, kind of live and hang out. And it's a convenient way to also pass everything through our immune system. So the lymphatic system is basically the home of the cells of our immune system, and it's again very, very important in maintaining fluid balance within the body as well. But again, often overlooked. I think it's worth looking into a little more. Respiratory system, again, without the cardiovascular system, the respiratory system would be kind of useless, but one of the things that the cardiovascular system transports is oxygen and carbon dioxide. So we are exchanging metabolic gases with our environment, and our cardiovascular system is transporting those gases to all the little cells within our body so they can use them. But the respiratory system, very, very important. That is our lungs, our trachea, bronchi, larynx, pharynx type structures that allow us to exchange gases between our body and the environment. Urinary system gets rid of nitrogenous wastes. Not all wastes are solid. Some liquid waste, and we need a fluid to dissolve them to get rid of. So that is with the urinary system. It regulates water balance as well as blood pH, ion balance. Again, blood pH is something you saw with respiratory system as well. So there's a few things that can be regulated by more than one system. But urinary system consists of our kidneys, ureters, bladder, and urethra. The digestive system again allows us to ingest nutrients, to build upon, to create new tissues, new structures, things like that. And allows us to get rid of the waste that we cannot use. Basically, it is the tube that is from mouth to anus, the esophagus, and the accessory organs outside, the liver, gallbladder, and here you see the pancreas as well, kind of hidden underneath the stomach. But again, we're basically a tube from mouth to anus. So you follow the esophagus, the stomach, the small intestine, large intestine, out the rectum. Basically, as we're absorbing things, we're compacting and getting rid of what we cannot basically use. But again, this should make sense. We need that cardiovascular system to transport these nutrients to all the cells, just as we did for gases in the respiratory system. So there are two different reproductive systems. We'll just collectively, put them in as number 11 for our systems, but we'll look at them separately. With the female, you've got the mammary glands, again, kind of defining mammals. One of the defining characteristics is milk for the newborn. You've got the uterine or fallopian tubes, ovary, uterus, vagina, structures of basically receiving sperm from the male and incubating the fetus. Again, with the male, you've got the structures, the penis and the testes, the vas and ductus deferens, prostate, the glands that contribute towards semen, and basically the vehicle of getting sperm from the testes to the uterus of the female. So you've got the reproductive system. So again, know these systems, know kind of examples of each, and that should do you good for at least this portion of the practical.